Welcome back, everybody, to another episode of the Auto Accident Attorneys podcast, brought to you by the Auto Accident Attorneys Group, where our motto is simple: we take care of you. We're known for helping people navigate the aftermath of auto accidents. However, this podcast, as you already know, is about so much more. Last week, we had a broker of auto insurance policies. The week prior, we were talking about life insurance. Today, we are going to speak to an optometrist and bring you direct-to-consumer information that you may not otherwise have access to. I am blessed to have Dr. Jonathan Chen of Vision Source Insight Eye Care from Sandy Springs with me here today. Dr. Chen, thank you so much for coming onto the podcast.
Yeah, thank you very much for having me here.
Let me give you an opportunity to inform myself and our listeners how you got into what it is that you do, and give us a brief introduction about yourself.
Yeah, happy to. So Jonathan Chen, I'm at Atlanta, born and raised. I
Nice.
grew up in Lilburn, Georgia, and attended University of Georgia for undergrad.
Go
Part
Dogs.
of my journey was trying to figure out what I wanted to do. And originally I went to UGA with the thoughts of doing pharmacy. Found out I'm not the biggest fan of organic chemistry. And so I had an idea of doing healthcare. And so I had shadowed a bunch of different professions, looked at it. And the story I say, as funny as it is, I started wearing glasses since I was in like fourth grade, but still never really thought about it until I think someone had mentioned it. And I was like, oh, like curious on it. Shadowed some optometrists, sort of see their day by day. It seemed like it had a pretty good work-life balance per se. And so I started working in like a group practice with ophthalmologists and optometrists there. And then long story short, attended a optometry program in University of Houston and spent a good 4 years there. Found out I guess I like studying so much. So I spent an extra year, my quote unquote, I say super senior year, of doing an elective extra 1 year for residency in
Okay.
St. Louis. There is a University of Missouri, St. Louis optometry school there, specialized more in cornea and contact lenses. And so that area is what I dealt with. Was there are some patients that let's say the front of their eye, the cornea, that clear portion of their eye, they cannot see well with typical glasses or soft contact lenses.
Mm-hmm.
And so we utilize what we call like medically necessary lenses, which are usually like a harder lens. And that helps provide some type of vision rehabilitation to allow them to see better and function during their day.
That is like a specialty that you went and studied for that particular symptom, I guess.
Yeah, precisely. I guess the journey on that was the first patient that I actually went to go see in shadow from an optometrist. This is like undergrad, just like had no idea what for the eyes, came in to see a patient. And I just remember he was getting tested for his vision, and like people say, like the quintessential, like a big E on the chart.
Mm-hmm.
And then but this was like with them putting the machine over their, in front of their face and trying to like ask like one or two. I'm just like, that's not how I usually thought things would go. And then, but then she explained that this patient had a certain condition called keratoconus, which deals with the thinning of the front of the eye. So I make the analogy of, let's say, imagine like a car tire when it gets thin, it sort of bulges a little bit.
Mm-hmm.
That distortion can cause distorted vision when light tries to focus. So I didn't think about it in the beginning, but eventually, as I went through school, I learned that there were so many more specialties that I could go into. And one of my rotations with now one of my mentors was heavily involved with that, and that just got my curiosity into it. And like, I think that would have been a nice thing to learn more about, and my journey sort of ended up in there with that extra year. Had a great time, really good, enjoyable experience, learned a lot, met a lot of great colleagues and friends that lasted through, yeah.
That's amazing. What was that called? The thinning of the pupil?
The cornea, front of your eyes.
Thinning of the cornea.
Yeah, keratoconus. So
How do I spell that?
KERATOCONUS. So kerato in the front is the cornea, and then conus is like a cone.
Okay.
So they sort of described, if you look at on like a web online search, is basically it sort of protrudes a little bit and becomes almost like a cone.
Keratoconus is the thinning of the cornea.
Yeah, it's a condition that causes thinning and causes distortion of
Oh, it's the
vision.
condition that causes the thinning. Is it degenerative because of age, or is it something that's biological, like somebody's body just does it whether
Yeah.
they're 15 or 50?
Great question. So, in essence, from what we can understand, seems like there could be a genetic component. And well, there is a genetic component from studies, and it causes some type of, when we're taught, some type of like non-inflammatory degeneration. Some people have a school of thought is also like excessive eye rubbing for people that are more susceptible, causes some type of integrity breakdown. And so genetically, I think as more studies come out, it has ranged from, in the beginning, it was like maybe if someone with a gene was like 1 in 5,000. And then now as more recent studies, I think 1 in like Denmark was like maybe potentially 1 in like 300-ish.
Oh, wow.
That had a genetic factor. But I think with many diseases, it ends up being, you may be having a little predisposition, but it's also how the environment and your lifestyle affects your health.
Right. I see. Is there anything in terms of the medical literature that's out? Is there anything that, like when we're talking about genetic predisposition, is it anything that we could see, like people with brown hair? Is it like that, or is it in like the DNA? Like you can't tell. I wouldn't be able to tell if my child is more susceptible to this or not.
I think it's probably more on the latter. I mean, there are some associations, but just because you have that, it's not guaranteed that you will get X condition.
Got it.
But it's just, yeah, in terms of that note.
Okay. So staying on the topic of symptoms and some issues, the catalyst for me to reach out to you and ask you to come on was because when we were going through my diagnostic testing, I had mentioned to you that my mother, who always listens to my show, by the way, she's my #1 listener. So, Mom, I usually do this at the end of the episode, but I'm sure you're really interested in this episode, so I'll jump in right now and say I love you and thank you for watching. My mom is always, she's one of those like helicopter moms, even at my age. She's like, hey, make sure you mention this to your doctor. So when she found out I was going to go get my eyes checked, she wanted me to ask about dry eyes. And I was like, I don't have dry eyes, but she does. And she said, I don't know if it's correct or not, but she was like, well, you might have a predisposition to dry eyes. I didn't even know what dry eyes were. Can you kind of give our listeners a little bit of insight into what dry eyes are and what might cause it?
Yeah. And so with dry eyes, right, a lot of it, I think the naming of it is a little tough because when you think of dry eyes, it's just like, oh, I got to feel something.
Mm-hmm.
And so what we're sort of in the profession is sort of have to realize that, but also as we learn more about it, there's so many different factors that can influence it. So from symptom side, some people can experience the dryness of their eyes. Some people may actually experience tearing, which is also like sounds off to them. It's like, you're telling me I have dry eyes, but my eyes just keep tearing up.
Right.
But then the thing is like, well, your eyes were probably dry and your body was trying to respond, and that's produced more tears.
Mm-hmm.
And so, and it's also ranged from other symptoms such as like fluctuating vision. The tears on your eyes do not stay on as long as normal. So then as that sort of breaks down, the quality of vision sort of deteriorates and it becomes a little fluctuated.
Refreshing a little bit of my recollection from my last conversation with you, you were telling me about when we blink, we're moisturizing the surface of our eye. How do I do I just call this my eye? Is there like a name for the surface of the eyeball?
Yeah, so I think you could say it from there. I know from in the profession, they'll say like ocular surface.
Ocular surface.
Correct. So like some people use, instead of dry eye disease, it's ocular surface disease, because that's why it's a sort of catch on to everything that could affect the front of the eye.
Okay.
And how the tears and it's a huge realm. Just for instance, I guess I'll say that recently there was like an international group of people that come in, basically experts in the field. They call it the Tear Film Ocular Society, TFOS, and they come together and they create a dry eye, like almost like workshop type of deal. And that's what's called the DEWS workshop. And each paper that they publish, the most recent one is pretty recent, and they talk about like symptoms, genetics, environmental factors, treatment plans, and everything that could be related. And if you look at that, like this stack of paper that you'll be looking through all those studies will basically be just like a good amount.
Yeah.
And so in terms of dry eye, I guess for most people, I'll talk about like a very common one, just like you mentioned with the blinking of their eyes.
Mhm.
So I'll start off in general is that our eyelids do a lot and helps protect our eyes. Every time we blink, I tell people it's sort of like a windshield wiper. It spreads, clears things out, but it also spreads our tears. We also got these tear-producing glands basically on the top of our eyelids. As they produce and our eyelids go over, it spreads that. Also in our eyelids are these oil glands, what we call meibomian glands. But these oils, every time you do a complete blink and your eyelids sort of close together, if you imagine these oil glands as like vertically aligned cylinders,
Okay.
that the gland, and at the very end is basically at the end of our eyelids. And there's this sort of small muscular ring around each of these glands. Every time we do a complete blink, those muscles sort of squeeze a little bit to express those oils.
On every blink?
Pretty much, yeah. Well, I say a complete blink because I can mention later is that for some of us, we don't actually completely blink. We do partial blinks. So if you imagine sort of going like 70% of the way and then sort of opening back up.
I see. When it's a partial blink, it does not secrete that oil.
From what I can understand with the studies, yeah, it's not as effective in terms of expressing these because it needs to sort of contract together and then those muscles sort of constrict and then it squeezes these oils. And those oils act to prevent your tears from drying up as quickly. To circle around our actual tears, it has probably multiple layers, but to keep it simple and most of like what I was taught was you got oil, water, and mucus in general. Mucus keeps the water on the eye. The water component provides the moisture. And then you got an oil layer trying to prevent that water from like evaporating as quickly.
Yeah.
And so our blinking is important to help express those oil glands. And that is what we call an evaporative type of dry eye disease if it's affected. And that is one of the most common forms of dry eye disease that we see out in the population here. And so in this day and age, with our digital devices, our computer, our phones, and all that we look at, that we have to be utilizing our eyes from all these visual tasks that we have to do, our concentration and focus, our blink rate tends to go down from what we naturally do. I think can't say recent study, but some studies have shown that more like when you read, your blink rate tends to go down. And especially when you're concentrated and focused, that blink rate goes down. And so if you imagine having a blink rate that maybe decreased by 40, 50% consistently when you are working, and we work for many decades, a long time, that can cause those oil glands to get more affected. Yeah, and I usually describe those oils, ideally, we want it to sort of look like olive oil, nice, liquid, clear. But because there's fats in those oils, for some people, it looks like butter. And when butter cools down, it can harden, thicken, and clog these glands and cause damage.
Is that what I'm waking up to in the morning right here in this corner?
Possibly from there, but a lot of times what can happen is you accumulate a lot of stuff in your eyes, your tears. And my analogy is like when you're at the side of the beach and the waves sort of crash right along to the sand of the beach, is that your tears, the water component sort of evaporates and you're left over with that little crust sometimes. That can be. But it could also be accumulations from some of the oils that are also around that eye.
This might be a very pedestrian question, but I've been working since it's been about 7 hours now.
Yeah.
How come there's nothing in the corner of my eye, but if I go to sleep and I wake up in the morning, there'll be something there?
Yeah. In terms of that, it could be a couple factors that I would be thinking about. One, normally your blink rate during the day, you're blinking and you have these drainage ducts along towards your nose that could be properly draining out.
Hmm.
When you're out, so it's being flushed out, you could say. When you're sleeping, it's not moving around as much. Your eyelids are usually closed. But there also is a subset of people where their eyelids actually don't close all the way in sleep.
When they're asleep.
Correct. So you have this little gap. My analogy is some people have like an overbite or underbite with their teeth. So all you need is a little crack.
Yeah.
And basically air just keeps getting exposed to your inside your eye. And so all the tears will basically dry up. You got some gunk on there.
You have a really great way of explaining difficult concepts for me you paint the picture in the mind's eye. All of your metaphors have worked so far.
Yeah, thanks. Yeah, try to think about that, but also utilize from, much smarter colleagues that have also utilized that. Yeah.
Hey, it's working. So I feel like I'm spending too much time on this, but I'm personally super curious. Is it when you're asleep and assuming your eyelids are closed, are those glands still expressing oil through your sleep, or do they shut off when your eyes are just closed?
Good question. I have not actually fully thought about that.
Yeah.
In terms of it, I guess theoretically by it wouldn't be as expressing as much just
Yeah.
because of that constant, it
It's
wouldn't
not.
be like a blink rate. But I'll have to look into that.
Okay.
Get back to you.
Well, we'll do a second episode.
Yeah.
Dr. Chen, going back to the dry eyes, sort of the same question I had about keratoconus. Is the dry eye symptom, or is it considered a disease if you have dry? It's a disease.
Correct. So it's like severity. Some people may feel like it's not bad,
Mhm.
but there is definitely, when it gets severe, it can definitely affect the front of the eye and cause damage to a level where it definitely needs therapy and such.
I see. And so is that disease, is it a degenerative thing, or is it genetic?
Probably more of a degenerative type of condition.
Can it also be caused by any sort of acute trauma?
Yes. Good thing that you mentioned that. Like many things can affect the surface of the eye. So you have in trauma by like injury, let's say chemical spills,
Mhm.
accidents, direct impact on it, based by surgeries around the eye. Now we're not really designed for it. If they become a little more invasive and they get complications, that can definitely cause that as well. You have certain severe conditions for people where, for instance, there's a condition called Stevens-Johnson syndrome where they developed a really bad reaction to, let's say, having like penicillin treatment, and their entire body sort of just like becomes inflamed up. And those patients can really suffer from dry eye disease.
Penicillin could trigger in some patients a reaction that is really bad dry eyes.
Correct.
Wow.
I mean, dry eyes, from like, let's take a more mild thing, just say there are actually many medications that can lead to more symptoms and feelings of dryness. So antihistamines, for instance, like our Claritin and such, Benadryl. It's an antihistamine. Just by naturally on that, it can sort of make our body a little bit more dry in general.
Mm. So I'm starting to gather, aside from like an acute trauma surgery, which I'll get to in a second, a lot of the things that change I didn't go to medical school, so I'm just going to say the chemical composition sort of of the system can dry you out. Is there any correlation between dry eyes and any other symptom of another body part? Like you have dry eyes because of a lack of liquid, maybe like your urine is not as clear because there's not enough liquid. Is there any sort of correlation like that in anything?
There can be from like certain conditions of the body that, right? I also tell patients like your eyes are attached to your body. So
Right.
if your body's not healthy, it can be easily transfer over.
Yeah.
One disease that might have gotten a little bit more, can't say popularity, but more people might have understood. One's called Sjogren's syndrome. I play tennis, so the reason I know a little bit more is Venus Williams.
Mm-hmm.
She has Sjogren's syndrome, and that's been shown for her. And that is a condition that can affect sort of like almost all the mucus areas around your body. So eyes, mouth, gut,
Mm.
like around the whole body that it can be affecting.
What kind of symptoms would you experience with the eyes with Sjogren?
Sjogren's, I think it's like
Sjogren's.
a apostrophe S.
Okay. Sjogren syndrome. What does that look like in the eyes, or what are the symptoms like?
A lot of times with dry disease, symptoms can be very similar, but they can be caused by different reasons. So for them, it can be the sensation of dryness all the time. They just don't feel like they produce enough tears, because the condition can be basically damaging to their tear producing glands. And so that can be a big factor.
What is the solution for this? Is it like Visine? Keep your eyes wet?
And so it becomes really difficult because with a lot of dry disease, at least to this point, I wish we did, there's no necessary cure. There's no silver bullet that can just be like, we do this and it'll be great.
Mm-hmm.
So what we do is best to manage the condition. And so a lot of times I tell the patients I work with is like, my goal is to basically make you think less about this dryness. Just sometimes they come in with me, just like, I'm dealing with this all day. And as we get better over time with our treatments, is like, if I only get you thinking about or worry about this like an hour of the day, that was great. Because some of them are just like, this is constant. I'm putting those artificial tears. I'm doing it like every hour.
Yeah.
And stuff like that.
That makes sense. I'm immediately thinking about my mother. She's got that tiny little bottle.
Yeah.
What do you know about that they're artificial tears, that little bottle?
Correct.
It's prescription based, right?
The artificial tears a lot of them are over the counter, or pretty
okay.
much they're all over the counter. And I get it. It gets confusing. When I walk through there, it's like the cereal aisle. Like you have so many things to select through.
Yeah.
And so they all get made with, some of them add a little different, like A, B, or C. We get a little different unique touch to it. But in general, I would say it is sort of like lotion for the skin, helps lubricate. It won't cure anything, but for a lot of people, you just need that added moisture, and it gets you that extra boost during the day, which can work out fine. The other, I guess, hint or tidbit that I'll say is that usually for a lot of these bottled artificial tears, there is a slight preservative to them. And so I usually say is like, if you can use those drops on average for about like less than 4 times a day, that's okay to use. But if you're using it like pretty frequently, more than that, and you're using it, let's say that every hour of the day, I usually advise to use a preservative-free artificial tear.
That's a good tip. Are there prescription strength drops as well as medication?
Good question. For artificial tears, there isn't, but with dry therapies, there are medication drops to treat dry disease. And there's quite a number, and they're growing, which is great for it to allow us more tools to better serve our patients. Yeah.
Okay. And then going back to, I won't delve too deep on the prescription stuff because he didn't go to pharmacy school. We said one of the causes of dry eyes could be acute trauma. One of the methods of acute trauma could be surgery. So is there a surgery that might be common for, I'll just say, for example, like do you see that somebody wants to get LASIK and they get LASIK and then they end up with dry eye disease?
Yeah, so that can happen. What we usually say is there's a fine line between like if one caused the other. But I would think is a lot of times people that had dry eye beforehand and they get the procedure itself, they will continue to have that or maybe a little bit worse. From LASIK, a lot of times they'll say is there can be some symptoms of dryness. For a number of people, like after 6 months, they tend to resolve itself. So I think in the community is like we need to be better at being able to detect it beforehand and deal with it, and prime the surface and provide the best ocular service, so that when they do a surgery, they're better recovery, better visual outcome.
So I love that response. So now I'm wondering, are there diagnostic tests to see if somebody is more susceptible to dry eye disease?
Yeah, so there's fortunately a number of diagnostic tests that we utilize to look for dry eye disease. If we want to start from the beginning, a lot of things is what our patients tell us. And so that is the biggest thing that we can utilize. History is important. as in your profession as well, is like what they tell you.
Right.
And in terms of that, we look at for symptoms and such. There are questionnaires that are designed to help streamline it and elicit what we think could be more dry eye disease related type of issues.
Mm-hmm.
But then, so like at the office that I'm at, basically we have the ability to to image the oil glands on your eyelids, so we can see the structure. If you imagine sort of like like a tube of sorts, if it's the full length, that's healthy. But then some people, it's like shorter. Let's say imagine half that length or a quarter. Or unfortunately, some people, it's a stubble and just like a really short amount. And that gives us an idea of how that is. We can also test, for instance, we can take a video, see how quickly the tears on your eyes dry up. You'll have little small pockets of the front surface that sort of dry up there. And then we can see how much tears sort of collect on the bottom of your lid. There are other tests that can measure, I'll say, quote unquote, like the salt content of your tears, the osmolarity. With people that have high or have dry eye disease, that osmolarity value is actually higher. And so and we also utilize to look at the eye if there is damage to the surface, something called sodium fluorescein, but it's sort of like this orange, I don't know if you saw like an orange, like almost like food coloring thing that they put in the eye, and we shine it with the blue light. What that happens is basically it glows green. And so what that allows us to do is it makes it easier for us to see like small little areas of like damage on the front surface or whatnot.
On the ocular surface?
Ocular surface, precisely. Yeah.
I'm trying to keep up. What was that last test called? With the drop, the dye?
The dye is called sodium fluorescein, but you could say like eye dye test or anything.
How invasive? I'm thinking if I'm a consumer, I'm considering doing this. A lot of people, like I get I get clients that need MRIs and they're terrified of the MRI machine. These tests, these diagnostic tests, how invasive, how long, is there pain? Talk to me a little bit about what that looks like for your patients.
In terms of the testing, mostly or in general, I would say pretty non-invasive. So like the imaging, for instance, that is basically flipping your lid down or flipping your lid up.
Okay.
The upper lid flipping, some people may feel a little funky from that because that's not something that's common.
Yeah.
The lower lid, majority of people are pretty good with. With the upper lid, I joke with some people, just like, oh, maybe you just did this as a kid and try to flip your eyelids over there. And then like imaging from like how quickly your tears dry up, that's as long as just can you play a staring contest from there. For some people, that could be tough.
Yeah.
But that would be the extent. And then like adding that little dye to the front of the eye, it's like an eye drop pretty much.
Okay.
From that side.
So I'm thinking for me personally, I think the most difficult would be the dye, just because I've never been able to get an eye drop. I freak out. I have to blink a bunch of times and hope that it goes in on one of the open moments.
Yeah. So it's like targeting that. The advantage of that is the doctor usually applies that. So all you have to do is sort of lean back, just look up, and they sort of just add a little bit there.
Okay.
Get through from that.
All right. So if I'm going through the next step of that, if we get these diagnostic tests and it turns out that the patient has shorter glands or stubs, so they're more susceptible, would their course of therapy change, or the way you would treat that patient change? Are there things that somebody could do proactively to stave off dry eyes?
So a lot of the treatment, it ends up being individually tailored just like you're saying, severity, symptoms, how interested are they doing about wanting to do something about it. But I do like the proactive approach of, even if I see small changes, I'd rather work proactively than try to deal with something way on the back end. Because especially with dry eye disease, many people may not feel symptoms until it gets to a severe point. And then also, one of the issues that we have to sort of deal with dry eye disease is that the nerves of the eyes, the cornea, sometimes with long-term chronic dry eye disease, the nerves aren't as healthy. And so they don't actually have that sense to feel it. And that leads to the body not having that feedback mechanism to like being able to respond. My analogy would be like sort of like with diabetics and like the foot ulcers and stuff like that. The body doesn't really feel that anymore. And so that is a issue that we have to deal with dry disease patients because I tell them that this is what I see and there's like, I don't feel that. So I don't.
And if they don't feel it, they're less inclined to do something, but
Precisely.
physically or physiologically rather, there's changes that are being degenerative changes occurring. And
Correct. And so that's a big factor. I think pictures, scans, photos definitely help because it provides some type of imagery for them to do it. But a lot of times, yeah, like if they don't feel it, it's like, oh, like what are you talking about? I feel great. It's like the high blood pressure person's like, I feel great. And their blood pressure could be really high and you just wouldn't know.
Right.
Yeah.
I got to do an episode on that. I have high blood pressure. So it does make sense. The information I'm gathering, the way I'm thinking about it, it does make sense for individuals to get proactive diagnostic tests done to see if they're more susceptible to this or if something is presenting, because there are treatments available that can not cure it, but at least slow it down, and you're not making, well, does it slow it down? Can you prevent it from getting worse? Or is it going to happen regardless of what you do? And we're just treating symptoms.
You can slow it down or reduce the irritating factor. Like let's say some people, stare at a computer all day.
Mm-hmm.
And then some people have changed jobs, not like because of this purpose, but like that helps reduce that risk factor.
I see.
Medications, they might have switched from there. And so I think from being proactive, I like that idea of working well. At the practice I'm at, we basically screen all our annual exams on the lower lids just to get an idea.
Nice.
So we're best able to educate them. And so I spend the time basically trying to talk about them and provide them with the information, best educate them, and they get to decide on how they want to pursue with that. So a couple of things that to answer your question a little bit a few minutes ago was what are some proactive stuff that we can do? Very similar to what I had discussed with you on our first time when we met. As funny as it sounds, being mindful of blinking is important because like I had mentioned early in the podcast is that our blink rates can be affected by concentration, our reading, how much time we spend on a computer. And so trying to be mindful of that and having good complete blinks. And then studies also show having like warm compresses are beneficial. People probably most likely have heard of that. So the idea, I make the analogy of like the butter analogy is that it's like nice and thick, pasty, use heat therapy to try to soften those glands and let them easier express. It gets pretty warm for those warm compresses. I would say a washcloth is not great because it gets warm, but it cools down in like less than a minute.
Yeah.
So there are like beaded masks that our office has had for patients where you microwave it and you can put it over your eyes. Ideally, we would like 8 to 10 minutes over the eyelids, and you want it at least, the studies show at least 104 degrees Fahrenheit, which is pretty hot. And so I usually tell people is using the back of their hand as guidance. You don't want it to be scalding where it burns that.
Right.
But you also want a good amount of consistent heat so that it will go through your eyelids into the oil glands. Fortunately, our eyelids are one of the thinnest skin areas. But it also does need some heat to be able to penetrate and get through there.
Is that 8 to 10 minutes a day?
Ideally, I try to be reasonable where it's like we all have busy lives. So if we can't get it all, it's like working out. If we can get it in, it'd be ideal.
I want to be clear on this. What I'm wondering, I'm sitting here, I don't have symptoms of dry eyes. At least I don't believe I have symptoms of dry eyes. Would it make sense for me to be proactive and get that diagnostic test done just to be sure?
So I think that'll be helpful to get an idea because many people, like you said, they don't feel it, but their glands might have already been changing and you just don't realize it. My analogy was like importance of like eye exams. It's like similar to having a physical and you getting your blood test.
Right.
You don't check. It could be fine.
Yeah.
But you don't really know. So at least get yourself a baseline, get an understanding what's going on, and then you can work from there.
like everything else,
Correct.
have the data, and then that way you may not do anything with the data today, but 5 years from now, you've got 5 years of data and you can see what's going on. That makes sense. You may not be able to answer this question, Dr. Chen, but this is sort of like the administrative stuff. Because of what I do, I'm acutely aware of the reimbursements and what health insurance pays for and whatnot. Let's say I've got no issues with my eyes, but I'm listening to this podcast and I'm like, oh, you know what? I haven't been to the optometrist in a decade, and I decide to go and I request testing for dry eyes. Do you know if health insurance covers that as like a routine exam, or do they ask the doctor, why is this necessary?
So that is a very commonly dealt with issue at an eye clinic. I'll put it that way. You have your vision plans and you have your medical insurances. And vision plans, I usually sort of describe them as like a discount plan, because if you look at all the fine print and everything, they'll provide you like sort of like a screening examination, like a wellness examination, like a physical, and then a discount on glasses and contacts, the hardware, as I quote unquote tell people. But if you look at it like anything medically comes up, it actually doesn't cover anything. And you get that one exam, you don't get anything else.
Yeah.
So it may not be like true insurance in terms of like insuring, like if you got into something bad, it'll continually help pay out and cover a thing for you.
Right.
So with dry eye disease, that ends up being utilizing your medical insurance. And the examination itself will cover it. Depending on, for, I guess, providers, we have to, in order to get reimbursed from insurances, we have to prove like medically necessary that these tests were done because we saw some type of disease and we want to know more about it. And so that sometimes is not always happen. And different clinics operate a little differently. Some may employ what I think would be almost like a screening fee to provide this for anyone beforehand, but allows that. But so from their operation side, that's how they operate.
I see.
Yeah. So it will probably differ depending on which clinic you go to.
Yeah.
Yeah.
I've just become really accustomed to seeing insurance be like, the insurance, I don't know, analysts or whoever it is, the representatives, they're making a lot of medical decisions without holding those specialized degrees.
Yeah, it becomes very tough for us. Like dry eye disease medications, for instance, a number of the patients that I see are in Medicare age that have Medicare insurance. And like dry eye disease medications under that has not been very favorable for them. And sometimes these quotes are excessively high, and it becomes a challenge where it limits providers from trying to provide the best care that they can for their patients. And then I'm pretty sure it limits the pharmacists because they have to deal with this. I'm trying to dispense this, but then patient gets quoted X amount and they're like, I can't afford, like, pay that consistently from there.
Now I'm curious about the pricing. What on the, not the over the counter, but like the prescription medications, what do those typically range? What does that look like if somebody has to take it in perpetuity, for example?
It's a whole range because as you realize as well, is that all these insurance plans, even though it has the one name of one large company, it doesn't mean that they're all the same. Right?
Yeah.
They have each HR company or that purchased that plan for their employees or whatnot, or even if you're individual healthcare, they're all different a la carte type of things. I would say it could range from anything from not paying anything to it could be like $600 a month. Yeah.
The cost of the medication or what?
Correct.
Okay. So
we're utilizing their insurance, like what it could cost. There are some companies in the realm that I guess saw the struggle, and so they may have self-pay pricing. And so that becomes a little more in middle ground. It could be ranging anywhere from like $60 to $100 a month type of deal.
For the medication?
Correct.
So it can be a really expensive endeavor if somebody is struck with this disease.
It can, and it becomes, it stinks on that end because they're trying to, for some people that are like fixed income and trying to purchase these separate medications, and they also got other stuff with their body that could be happening.
Right.
And they got to deal with that. And so there's a lot of things to navigate through.
Is there an age component with dry eyes? Is it mostly older people?
USA in general, yeah. Age is one of those factors, as I tell people, as we get wiser, things change a little more, and our body does. Hormone changes plays a big factor. So with dry eye disease, studies show that women get more affected more often on that side. And so, yeah, those are some of those risk factors as well.
I had asked earlier, I brought up LASIK as an example to ask, is there something that I'm looking for like a golden nugget here? Is there something that people would routinely do in this industry that they, I'm talking from the patient side, that they decide, I was looking for LASIK, but obviously that's not it. But is there something that people will do for surgery or a type of glass or a contact lens that has a statistical higher probability of causing whether dry eyes or degeneration or any sort of injury that people don't really consider, and they do it, and then after the fact, they're dealing with something? I'm just like creating this scenario, wondering if there is such a thing.
Probably is something there. Maybe we haven't looked through. I haven't looked through the data to really go
Okay.
through that, but I think some that maybe unintentionally have occurred. I'm not saying that this happens to everyone, but a common one that I also just ask and screen patients that have dry eye disease or with their oil glands that are really shortened.
Mhm.
I'll ask if they had used like Accutane for acne. That can be common for a lot of people.
Mm.
Acne works great. I mean, Accutane works great for that. It gets those oil glands. But the issue is they're not selective, so it can affect other parts of the body.
Yeah.
The reason that I remember that is just like one of my classmates. If you imagine, like, we have about, let's say, 30 to 40 oil glands on our upper lids and a little bit fewer on the lower lid. My classmate, when we were in school, got them imaged, and she had like one.
Wow.
One of the thoughts was possibly like the utilization of Accutane when she was a teenager had contributed to that. So I'm not saying this not to use it. It's just be
Right.
mindful of maybe screen beforehand, get an idea if that is something that could cause changes.
I don't know who the manufacturer of Accutane is, but nobody's making any accusations.
Correct.
But that's exactly the type of thing I was looking for, honestly. So I'm really appreciative that you had it. Sort of the thing that where people don't associate and until like after the fact and be like, oh, there's possible correlation there because of it affecting the
Yeah.
oil glands.
Another one, it's sort of indirect as well, sleep apnea. I think more and more people are being discovered to have that. I think it's definitely more people in the population that have it than we think.
Yeah.
And so there's a lot of people with sleep apnea have CPAP devices that they utilize. And so you have this airflow around when you're sleeping.
Mm-hmm.
And if they don't have like a great mask that helps provide, definitely has a good seal with the air, basically you got air just blowing around on your face. I have a number of patients that have that complaint because I dealt with one where I saw a lot of irritation and dryness because that's what he came in for. And it was just all around and was getting him better, but we really had to figure out like what was going on. And so this is when like for us is like looking through the history, asking these pointed questions, seeing what's going on. And in the end, it was sleep apnea. He used a CPAP device. So he got a different, I guess, air intake or over his mouth and nose in there.
Mm-hmm.
And it definitely cleared up much better.
It's almost silly because it has nothing to do with medical history. It has nothing to do with what's going on. It's because of the mask and the air's going up. But I guess this is exactly where you was talking about how much you rely on patient information, like to share. Like, are you on a CPAP machine?
Yeah.
That's interesting. So, okay, guys, sleep apnea, Accutane possibly, but it makes sense because it's attacking oil glands. I really appreciate your time. I hate to wrap up because I've got so many questions. My last question is going to be, I took my eyesight for granted. You said you started wearing glasses really early. I thought I would never need glasses. And I'm pretty new to them. It's been a couple years. They're supposed to be readers. Now I have to wear them all the time. And it's getting worse on my readers. And when I saw you, I got my prescription upped a little bit. I'm not accustomed to wearing glasses. These things get smudged all the time. What do people do that have glasses? Do you have any tips, practical tips to keep your lenses from being smudged or keeping them clean more often? Because I feel like you're talking about the eye drops 1 hour a day. I have a box of those disposable little wipes. Every hour I got to pull them out and wipe them clean.
Oh man, you are not alone in this aspect. I deal with this as well. But it's like, as one factor with glasses is when we have that anti-glare coating and trying to have that anti-scratch and such, it's very, sometimes those coatings can be very easily to get those smears and dust on it. I wish if someone can get that, like some type of solution for that, that'd be an incredible idea from it.
That was just a selfish question for myself to be like, how can I deal with this? Dr. Chen, to wrap up, I tend to, at this point in time, turn it over to our guest. If there's anything that you feel like we should have discussed that we didn't, or there's some piece of information that you think our listeners could really benefit from, or anything in your heart that you want to share with.
With dry eye disease, there's so much stuff. I think we just sort of like cracked the surface in a way from that. But I would think in general, for like our oil glands, for instance, being mindful of blinking, utilizing warm compresses, I would say is be mindful of breaks. I usually say is from a routine, don't stare at a computer screen all the time. Easier said than done.
Yeah.
I would say is like, but try to allow a little break and pause. I think your body would like it to walk around, right?
Yeah.
Instead of my sedentary lifestyle, you could say. And oil glands, also studies have shown that having good amount of omega-3s are beneficial. From
omega-3s.
Yeah. So a lot of times if we can get it from diet, that'd be great. But the amount of omega-3s, a lot of people utilize like fish oil supplementation for that, or like algae like component for the ones that are not like more vegan type of lifestyle. Yeah.
Awesome. You were chock full of great information. I personally got a lot out of it. I know my mom is listening. She's probably going to watch this twice. She's going to ask for your contact information. Mom, it's going to be in the description of the YouTube video, so you can reach out to Dr. Chen. Got you a new patient. I know that already.
Appreciate it. But thank you again for having me here.
Absolutely.
It's been a blast.
I appreciate your time. All right, everyone. Thanks for tuning in. Please, as always, I'm going to ask you to like, comment, and share as it helps me out. Mom, I love you. I'll see you all next week. Take care.